Thank you so much. Appreciate it. And Lirio, overall, really appreciate you guys organizing this event. I know with all of the circumstances going on, being able to share the success that we're having and the previous presenter and helping people with coronavirus and also who are fearful of coronavirus, we're definitely seeing a lot more engagement, the same as what you guys just mentioned too. So appreciate the opportunity. So what we're discussing today is how to become an influencer in your patient's life. Full disclosures are the fact that I am the CEO and co-founder of Virtual Health Partners, and we'll be discussing a little bit about the platform today, but really more about overall virtual solutions and how to utilize them to help drive engagement and improve outcomes. I'm just seeing delay. I apologize, guys.
Jillian, if you make sure that you look at the presenter screen as opposed to the attendee screen, you should be able to stay in sync with your slides.
My forward button wasn't working, and now it is. So I think we're good to
Great.
go. So,
Awesome.
you know, our objectives today are to explore which patients and what patients trust in today's world and what's influencing them, right? So when we think about a patient, an end user, an individual, what is the key influences in their life? We're also looking to understand how to drive patient engagement through technology for a better quality of care, and then also uncovering how we can better engage leads to improve outcomes for providers and partners. And so, you know, I think this is always a funny slide to start with because it's really interesting to see who's influencing people and patients, right, in our lives today and what their perception of nutrition, fitness, and behavior modification is. So first we have Natalie Portman, who's doing cooking demos on Instagram. Natalie Portman actually grew up in a town close to where I grew up, and if memory serves me right, she actually hates to cook. So the irony of her now doing Instagram videos for nutrition is somewhat ironic. We have Beyonce and her infamous crash diet and her talking about over and over again how hungry she was before Coachella. We have Antony from Queer Eye for the Straight Guy for cooking and nutrition, and now he's a chef, moved on from a decorator. We also have Cameron Diaz, Kim Kardashian, Gwyneth Paltrow, and many others who all like to influence what patients see and think that they should be eating. So, you know, when we look at this, is this really working for patients, and is this really achieving the health status and outcomes that they're looking for? So people are, first of all, confused about nutrition, right? We know that there is even ice cream diets that have been rolled out on the internet that if you eat ice cream, you can lose weight. We also know that people aren't getting enough exercise. 23% of adults are really only utilizing any physical activity on a weekly basis, and that they also look to assimilate the concept of nutrition with dieting. So what does that really mean? People think about the fact that nutrition equals I need to lose weight and diet instead of having a healthy lifestyle with proper portion sizes, protein, hydration, and the like. Lastly, we also look at behavior change. People really think of this as a negative item because of the lack of motivation and making changes alone and experiencing too much stress. They really think about this as something that they can't change and something that they have no control over. Only 16% of participants in the study have reported being able to be successful making health-related improvements on their own. And so, you know, what it really comes down to is why are people afraid and why don't they think they can make change? And how can we influence this? So even if people shouldn't be listening to influencers considering their nutrition, fitness, lifestyle, and modification, behavior modifications, influencers are how they know like who to engage with. People know to go to Instagram. People look to their apps and look at what's on Google for their answers. And this whole concept of going live on Instagram to answer a question when Kim Kardashian has absolutely no background in nutrition, but she's answering questions about her recent diet and workout, it makes you really wonder, you know, how people can find a tool and a resource that can give them the ability to know that it's a validated source, but also how can we take that understanding of why people are going to social media and move this to the HCP, right? The person who can actually really influence a healthy lifestyle. And we see that being able to be done through apps and through engagement. So, the real question is, how can an HCP become an influencer? What is it that an HCP can do in their patients' lives to really drive change? And they need to be able to have something that feels personalized to them. They need to have a simple UI, UX. They need to be able to ensure that their population, I know the last presentation spoke about age, it needs to be relevant for all ages, right? It needs to be something, and I always joke around about this, that I don't have to get 10 phone calls from my mom about with how can she turn this on and how can she use it, that she can download it and make it go. And to me, that's really the key piece of any technology, right? At your fingertips, being able to understand what you can do and being able to understand how it can help you. And if we're able to drive this and the HCP is able to be a voice of this and to be the influencer, you actually can succeed in positive change. So when we look at the lessons for driving engagement with patients virtually, there's many out there that have succeeded in driving patients, whether it's for one-on-one doctor's appointments or it's for ER visits. But how do we deal with the chronic conditions? And how do we deal with the continuous delivery, right? So first of all is you need a place, as we were discussing, that's all-in-one comprehensive support. We also need to be able to provide things that are condition-specific and allow AI to work for that individual. Not presume what they want just because they've clicked on an expensive bag on Instagram or Facebook, but because it's what they're telling us that they want or that they need to achieve their goals. We also need to be able to educate, right? We need to educate in short clips in ways that are trusted, in ways that are meaningful. We have to be able to enable our patients to make decisions with the data that they're seeing about themselves so that they understand why that data is important and how it is meaningful to the goals that they're trying to hit. Last but not least, we really need to create direct lines of communications between HCPs and experts and the patient themselves so that it's not just when you're showing up to the doctor's office, but that it's a continuity of care that's able to be a full ecosphere. So how can we do this in one comprehensive solution? And really that's what we started off with ourselves from an MVP perspective when we first decided to jump into this field. And what we've seen is massive amounts of growth. We can't keep up with the number of calls that we're getting for a comprehensive solution because of the coronavirus and the need to be able to have things that can be done at home where you're not at risk, especially if somebody's dealing with an isolation issue. And people also don't want to have to use multiple apps. And that's really what we're seeing. Something that's easy and that's an all-in-one system that can be delivered at somebody's fingertips. So what is condition-specific care and AI profiling? What does that mean, right? There's many ways to provide virtual support. You can provide live virtual individualized support. You can do live stream classes. You can utilize an on-demand media library that so many have. But what it is the ability to have these resources so that they fit into the care that the individual is looking to have, to be able to influence what their needs are, to become that influencer. And the ability to have that constant contact. How many of us on this call, if we were in person, I would do a survey of the audience, have actually looked at our phones in the past 5 minutes, 10 minutes, sent a text within the last hour for sure. And that's what we need to be able to start doing with those that are experts, right? The reason that people like influencers on Instagram so much is because they're so reachable, or they feel reachable because someone's constantly responding for them. It's not really them. It's really all of the people that they employ to be their voice. And that's when, as a physician, if we can start providing within the medical community, we'll really be able to gain a full voice that's an ecosystem that is able to influence that individual. So when we're looking about personalization, I always like to use myself as an example. So I have a girlfriend from college who's the head of digital media for Gucci. She lives in Milan, and she is always teaching me something about the ability to target and to market and all of the things that go into getting to somebody to buy a $3,000 bag. So I love looking at the ads on Instagram. I get retargeted for handbags probably about 7 or 8 times a day. And the cost of the ads that are trying to reach me when I'm not a person who's into handbags, but I'm just interested in looking to see what she's doing to get her audience moving, and the engagement and the messaging she's using is fully wasted. However, from my behaviors on social media, one would think that I was interested in the luxury market. I bring this as the point to the fact that it's really important to address the goals that an individual has and not just what they're clicking and tapping on. So AI is great as a predictive tool, but you want to utilize that AI to be able to ensure that you're delivering algorithms from your back end forward that are important and relatable to the individual and why they're with you. So what we've created is the ability to profile based off of data that's relevant to nutrition, behavior modification, and exercise, so that we can actually help that empower the individual to set their own goals, to become their own influencer in their own life in combination with their provider, so that they're obtaining what it is that's important to them. Something else that we learned, and I always credit our head of our clinical team for this, is during our MVP stage, we call them clients now, our end users or patients, were saying that their number one goal was not even existed on their provider's goal list for them, and it was usually third or fourth on our nutrition team's list. So why is that? The patient and what's driving them and what's important to that individual is really different than the numbers that they're getting back from their blood work. They want to be able to chase around their grandchild. They want to be able to be at batting practice and swing the bat and not embarrass their kid that they can't do that any longer because of being obese or because of being overweight or because they need a total joint but they can't safely have that surgery. So all of those factors come into play, and they're really socially driven in the person's mind, but they all factor into the numbers on the page. So it's marrying those two concepts, and once again, to be able to give that patient that empowerment and really become the positive influencer. So building education into a platform. How do we build education into our platform so that somebody wants to see it? I don't know about you guys, but when there's a 1-minute advertisement on, I sit there and I want to shoot myself. Oh my goodness, this is so long. When is YouTube going to start? And then you're counting down those 8 seconds until you can start that video, right? And it just feels like the longest 8 seconds ever, but when you're running late through security to catch a plane, it feels like the shortest 8 seconds ever. That happens a lot to me on both sides. But really what it is being able to build education that's meaningful to somebody, that's in tidbits or short clips that actually resonates with what somebody's needs are. So whether it's the fact that they're cooking for a family and they want to be able to do all their food shopping on a Sunday and they have a very strict budget, or they are fighting cancer and they want to be able to join a family meal but are dealing with multiple symptom issues, you have to be able to educate that individual and provide context for them to be able to receive that education and receive the content that they want that's relevant to them at the time. So it's really important also to ensure that you're providing information that can be relevant, that can also lead to the person being able to make changes and to be able to make positive changes, so that these are simple tasks that somebody can do. I am not going to say negative things about myself in the morning. Watching that video, making that post-it note, and putting it on your mirror is how a person can actually be educated. And it's those simple tricks that we all use in business that can actually really be used within our behavior change as well to have sustainable outcomes. The next item is really enabling patients to make decisions with their own data, right? As I was touching on, what we've known and we've seen from multiple studies and surveys that we've run ourselves is that what's driving an individual is not necessarily the numbers that are driving the physician in their care. So how can we marry those? How can we make it so that they actually can work together and that the person's feeling empowered by their data and not feeling as if their data has been stolen by Facebook? So I think it's about, once again, ensuring that the data that that person is following and tracking is meaningful to them and able to influence their changes, but it also aligns in with what their physician, who should become, or their provider becoming their true influencer, is hoping for them for a longer term outcome. Last but not least, I touched on this earlier, I think it's a really important piece to have a team around you that can communicate for you as the provider, right? It's the fact that the digital relationship is changing how all of us communicate, and that concept of not being able to have it now. I always joke around with Charlie and the Chocolate Factory and Veruca Salt's, "Daddy, I want my golden ticket now," and she stomps her feet. That's how we all kind of react. Think about when someone doesn't text you back. I remember the fun dating world where you're sitting there and you're like, oh, I can see the lines popping up and he's texting me, and then he's not texting me, or should I text him back, right? This also comes into play in our professional areas, and it also comes in especially when we're looking at patients and what they're looking for. So that ability to have constant contact and communication and to move those lines together when you have experts that are helping on your behalf really helps to be able to become that influencer, so that they're coming to you and as the provider, or coming to the people that they see that are part of your team, instead of those that are trying to just act on your behalf as an influencer on Instagram and really don't know what they're talking about. So, I think in summary for this section, it's really important to recognize that engagement leads to improved patient outcomes. And we'll have some data that we'll run through with you to show you how that works in a moment. But it's really about the fact that patient outcomes can be driven by weight loss and other condition-specific goals. And it leads them to becoming more satisfied with their provider or their HCP. It also becomes a time savings for everybody who's involved and everybody who is looking at their watch and trying to run around and accomplish everything in that 9 to 5 zone, including work and supporting their family. They're able to do something when it's not that crazy rush hour and they're not running around and actually being able to concentrate. So all in all, it really leads to a cost savings ability, and it also leads to the fact that you're looking at that patient and individual from a preventative medicine perspective, which we know is becoming rewarded from how reimbursement's now working with referral programs and, taking action to help treat these chronic diseases. So, we know from research that that orthopedic procedures are affected by BMI, and that BMI, the higher it is, the more likely that the outcomes of a total joint or a total hip will not be as good. Readmission rates, infection rates are much higher, the ability to have a full recovery. And then when we think about the employers are also concerned about it, especially in today's day and age of self-insured health becoming so popular, that worker does not get back to work, is not able to be at 100%, and the time lost from work is far greater. So we worked with multiple orthopedic departments, including Stanford, to be able to show that nutrition and lifestyle modification plus fitness can actually have a positive impact on reducing BMI, and then also as a follow-up, their ability to be able to reduce infection, length of stay in hospital, and also the ability to get patients back to work and have more optimal outcomes. So I think when we think about the impact that nutrition, lifestyle modification, and fitness can have, and setting proper goals ahead of time with not just the surgery itself, but with the overall health of the individual, there's a very, very strong message here. We also know the same thing's true in cancer. There was a large study done with Dana-Farber. We're now fortunate where we're working with multiple payers who are covering the platform of virtual nutrition and lifestyle modification and fitness for individuals newly diagnosed with cancer and or who are who are suffering from malnutrition. And we know that it's able to reduce readmissions, reduce hospitalization, but also give somebody a more comfortable lifestyle to be able to partake in family meals, to be able to join in on meditation and yoga classes virtually without having to be a burden to their family when traveling to a location or needing help or assistance. It also helps the mindset. As we know, mindset is so key when it comes to fighting cancer and the ability to beat it, and we're really able to support all of those areas. And Dana Farber had done a wonderful study in showing the impact of this, and we're now showing the same abilities from a virtual perspective. Last but not least, chronic kidney disease. I know it's a huge topic, a large cost to society. And when you think about the ability to work with employees and reducing them from being on the high risk side for employers, but also means of helping to treat them from a chronic condition perspective for the HCP, nutrition, and lifestyle modification and fitness are all key components in being able to both create a healthier individual, move that person down from that very high tip of the iceberg into a more moderate risk factor. And also, we know that they cost 14 times more care dollars per person for anyone who's suffering from this disease, and the ability to provide cost savings is tremendous. All in all, when we discuss becoming an influencer and increasing engagement, and I use the two together, it's really about ensuring that somebody understands the value that you can bring them, not just improved outcomes and reducing costs on the provider side or the insurer side or the employer side, but really about what it is that you're doing for that individual. I always say to the team, it's the WIFM, it's what's in it for me, right? And that patient can't see benefits up front, then they're not going to want to participate, and that whole ecosystem of care comes out of the window. So being able to show that person what value can be brought and how it can work for them, along with the fact that you're able to become that influencer, is really key to be able to have great engagement. I have right on time for some questions if there's any.
Thank you so much, Jillian, for that presentation. I really enjoyed hearing what you had to say, and I know that all of us can relate to the growing concept of the digital front door and just how critical it is to really be able to engage with patients at that level. Could you speak a little bit to some of the content, maybe like the content sourcing and sort of a little bit around where that, I know there's a lot of different components to the program, a lot of different options within the program. So if you could just speak a little bit to some of the content sourcing.
Absolutely. So all of our content is actually made in-house, and it's aligned with any of the national or international societies. The content is relevant so that we have topics within healthy living, on the nutrition side, food shopping, trends especially are extremely popular. So when ketogenic diet is trending and people are thinking of just jumping to that and it's going to be their saving grace, we have all of the different classes that cover anything that is trending. Especially sometimes there's things that come out within the media where it doesn't capture the full study, and we're really able to dive into it and explain what this means for the individual. On the lifestyle modification piece, we really complement behavior health programs. We're not providing therapy ourselves. We're providing coaching and the ability to work through stress and long-term results in collaboration with therapy if therapy is needed, or if therapy is not needed, we are able to help really manage that and change whatever the behaviors are that are, necessarily the crux of the situation. And last but not least, we have a huge library of meals and recipes that our nutrition team has curated to be specific to the condition that somebody's coming in from. So God forbid somebody has cancer, but they're also obese and they have hypertension and they're having dry mouth. That individual is able, from their chemotherapy treatment, that individual is able to find meal plans and recipes that relate to them. I think one of the last pieces of our content that is so unique is our fitness. And our fitness library, there's a lot of, stream fitness classes out there that are wonderful, but we've really geared it to a population that doesn't currently go to the gym or is intimidated with the gym or can't necessarily get to the gym or to a fitness club or a boutique class. And we, one, bring those classes to them, but we've also have a huge amount of content that enables somebody to not have to get up and down off of a mat, because if they're going for orthopedic surgery, they can't get up and down off of a mat. They can't walk the steps that they want to do. So we have low impact classes that are designed specifically for them.
I think that's awesome how responsive it is to, like you said, to the audience and really understanding the end user there and making sure that things are tailored to that. And I know that trends as they hit trends and fads are certainly probably one of the biggest challenges that a lot of organizations have to deal with when people don't have the full story, especially when it does hit the news. And speaking of news, I know one of the big things that has been a little difficult to really get the full picture has been around the coronavirus or COVID-19. Can you speak a little bit to why your company is so busy with the increase of the COVID-19?
Absolutely. So I think it comes down to the fact, and I live in New York, so I know that there's multiple communities that have now, been placed into pretty much isolation, if you want to think about it that way. And then it also draws fear. I've never seen the fitness clubs and restaurants in New York City. I walked into a supermarket and it was like a ghost town last night. And people are fearful and people don't know what to expect, and we're actually able to provide them with a virtual resource that is a trusted resource. We've increased the number of views of our fitness videos dramatically. It's day by day increasing in the thousands percentiles. I think, and that's really because people would like to still work out and look for workouts or look for other remedies to be able to release the stress or the unknown, and we're able to be that solution. And we're also able to provide that in conjunction with any of our partners.
Terrific. And one final question I think we have time for. Can you speak a little bit to integrations that might be necessary for using any of your content, or is that a requirement? Is that an option, that sort of thing?
Absolutely. So we do integrate with multiple EMRs. Any of the EMRs that are functioning with HL7, we're able to integrate with, whether it's a one-way feed or a two-way feed. That's possible. We work with databases such as Salesforce to be able to include who's able to be invited into the platform. Our platform is completely B2B2C, so that means that an individual can only come in if they're associated with one of our partners. Our partners would be a health system, a insurer, self-insured company, or we also have product companies that work with us, whether it's fitness clubs or fitness equipment manufacturers, drug companies, medical device, and nutritional supplement companies, where they include their product with the platform that's white labeled to be a full enterprise level solution for that product or for the health system.
Well, thank you so much, Jillian. Did you have any final things you wanted to say before we wrap up, and we'll transition over to our final presenter for the day?
No, I really appreciate this opportunity. I hope everybody who's on the call stays safe, and that if you are quarantined, that it goes by quickly.